I welcome everybody who is interested, and our staff in general, and our powerful nurses who are really making our work really the best in town. Today I will talk about the hair transplant. As a hair transplant, you know, it's advancing very quickly, especially now we are advancing towards non-surgical intervention. And in Adamaa, we are the only, I think, center, and as far as I know, in Saudi Arabia, who does follicular unit extractions. However, I think there are centers outside of Saudi who does it in the Arab world, but I'm sure there are lots of centers outside of the Arab world. And today, I would be mixing some information in general about hair transplant, but I will mention one thing, which is maybe some of you may see either patients or see in general some of the patients who did a hair transplant outside. And there are things which we've seen as part of the culture. Some patients were transplanted somewhere else. Some of them are good, but some of them have a problem, and some of them they don't know that they have a problem actually, because they encountered other issues such as carried some kind of infectious things like hepatitis or something because of very poor work they did outside, or because of the sterilization and care that they should be following the full medical practice procedures, which sometimes absent. And I had a trip to other countries, especially one of the countries where lots of people go to do hair transplant. And really, I was shocked. I was really shocked to see what's going on, because people, they just care about the money, and that's all. They don't care about their health. And when they purchase their car, they pay a lot of money. But when they go to their health, they really look for the money, and they look for the cheaper price. They forget about their general health. So Adamaa Hospital is trying to combine private sector and academic work as much as we can. Beside doing the excellent job we can really give to our patients, doesn't mean we don't have whoever works and generally works, they usually have some kind of mishaps or side effects, and that's known and acceptable. And we have mostly satisfied people, but sometimes you find somebody who's not satisfied, which is normal in life. I don't know if my voice is okay, or should I go higher because of the noise upstairs? Can somebody ask them to stop for just 15 minutes, 20 minutes maybe? So before I go to general discussion about hair transplant, I would talk about the hair loss in general. And this is the most important thing for dermatologists, practicing dermatologists especially, to know. And I know they know it, but the problem they don't know, and it's truly they don't know. And lots of them, they don't know how to treat patients with hair loss, male or female. And I know this will take a little bit of time till we get the noise off from upstairs, but this is very important. The androgenetic alopecia in women and men is patterned and classified in men from 1 to 7. In women, it says 1 to 3, that's in the textbook, but actually, lately now, it is classified up to 5 classes, because you see with time, whoever is doing hair loss clinic, they will understand with time the small differences between class and class, especially in women. In men, it's obvious. And there is another also type of classification in men, which called frontal hair loss. And that goes up to 5 classes. It's not mentioned here, but it's there. And there is also one thing in men, and it's not also mentioned here, It's called temporal hair loss, which is here. And it's classified to 4 classes. And actually, you can tell even somebody who's wearing a cap or a cover to his head, a man, you will know that he is bald by just looking at the sides. If you see the sides there is no hair on the side, they are bald, even though they're telling you they are bald. Because it goes with class 6 and 7. This is most of the time it's lost. So now we are also doing a correction of the temporal area and which perfecting our results. So the hair transplant in general, it's an art. It's not a number, and that's very important. Lots of people who go and do transplant abroad, they look for the number for the money, and that's very, very wrong, because whatever you take from your back, you lose it for good and will not come back again. So you have to be careful about the number of grafts you're pulling from the back, and you have to put it strategically to a point where it looks cosmetic. And that's what we're trying to see, which is called planning of hair transplant. And we could do a result of 4,000 grafts and only 2,000 grafts. And that's very important. So hair orientation distribution is the essence of hair transplant. Now, a simple photograph of a shaved hair on the back of a donor area, it shows you our terminology. We say follicular units. Follicular units are from 1 to 4 hairs. That's 1 hair, 2 hairs, 3 hairs, 4 hairs. And that's about a normal people. This is 30%, this is 30%, and that's 30%. This is around 10% mostly. But however, there are different variation. Sometimes you get patients with 4, about 30%. But sometimes you get only micros, up to 80%, which is 1 hair. And if you see this small hair here, it is called miniaturized hair. And the percentage of miniaturization, it's diagnostic for women for androgenetic alopecia if it exceeds 20%. However, this is not a hard rule, actually. There are other patterns which make you make a diagnosis. This is a graft being taken by either slivered, cut, or being punched out. And this is 1 hair, 2 hair, 3 hairs, and this 4 hair. You see the variation here in the roots? These are different stages of development. There's the one here, you noticed? So this is the most tall one, which is the anagen phase. And this is maybe the shortest one, which may be in that phase of telogen. Telogen actually may be reaching up to here. You know the bulge theory of hair growth, which is very important, of the hair growth, which is, people, they thought the hair come from the matrix, which is below. It's not true. We have something called bulge, where it's the opposite to erector pili muscular insertion. And that's the origin of the hair growth. And this is a transverse section of a hair. It's called pilo, that means sebaceous, pilo hair, sebaceous unit. And you see this is like, that's a hair, that's a hair, that's a hair, and these are the sebaceous glands surrounding, which give you the oiliness of your hair, which goes across the root. So depends on how active these ones, you have either oily or dry hair. So, maybe you could see somewhere here, this is the muscle, just part of it. It's called erector pili muscle, which make your hair stands when you get cold or you get scared or something. And this is a sympathetic control. This is called safe donor area. I think you have to remember this. So you know the photograph I'll bring you later on about people who are posting their photographs on the internet. So this is the safe area. That's Walter Anger book. You see there are areas you cannot take from them. If you take, you will lose. So in general, when we take now from donor area, we usually don't exceed this line. It's anterior tragus line, or mid-meningeal line, where is mid-meningeal artery is there. So that's the line where we don't really exceed and goes up, down there. And this is a protrusion called, where the insertion of the muscle, the trapezius muscle, that's a nuchal ridge. If everybody could feel here in the back, you will feel there's a bone, and that's called nuchal ridge. Most of the time, we don't like to go below the nuchal ridge, most of people. But however, it depends on the category of the face, or the scalp itself from the back. Sometimes it's flat, and maybe it's pushed down, so you can really, it's safe to take hair below that. One of the most important things in screening patients for hair transplant, we have to look into this area. If this area is thin, and this area is lost like this one, you see there is no peak here, it's not considered. That means it's very important to know. If the patient is young, you have to be extremely careful of taking grafts because they may lose up to here. So you have to be extremely careful. That means whatever you put, they're going to lose. Unless they use medication, obviously, but most of the people we see from abroad, they never take medication, and they take thousands, and that's all. So now we're going to go and talk about the hair transplant in general in two types. There are the follicular unit transplant, which is the surgical method, and the follicular unit extraction. That means a strip, and that means this one is just punched out and taken out by either hand or machine, by either like a punch biopsy, which is less than 1 millimeter, or with the rule of machine to get higher number. So, and if you see the benefits between both of them and pros and cons and for each, a strip of the safe donor area of the scalp, that's the only area you can take, but however, you will find the scar always there. However, in the FUE, there is no obvious scar, most of the patients, unless they are dark skin. Dark skin, you have to tell them there may be a little bit of white spots. Actually, in FUE, also you can take from body hair like chest or some other areas. This has to be dissected on a bench. Here, no, it's more labor. You have to just take it by yourself, each by one by one. This is more time-consuming in FUE. There is a permanent lung scar, as we mentioned a while ago. There is a high risk for the hair follicle if it's not handled very well. And transaction rate is very high here. You have to be extremely careful. Our transaction rate, luckily, we have less than 5%. Generally, the world is about 5 to 8%. What we see from outside, you know the transaction rate, that means you cut the follicle from the middle, and it doesn't grow. This is faster, and this has to have a very special training. It's less expensive, this is more expensive because it's labor intensive. And hair transplant, we don't get the unit as a complete. This is my hand drawing. When we take from the back, we have to be careful not to really take everything from the back, and then the patient look bald in the back even, with the donor area. So we have to be jumping and taking, you see the red marks, you take here, 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 here. You don't take adjacent to each other. Otherwise, they will look really deserted area. And sometimes we don't say one hair, we call it 1.5. It's one hair, actually 2 hairs, but it's growing. And it says it's this is maybe at the telogen phase, which takes about 3 months, and it falls and comes back again. But sometimes you think it's 1, but it's not 1, this is 2. So you have to be careful, especially for the transplant nurses who are putting the grafts. They have to be careful. With 1.5, they shouldn't put it on the hairline, because with time it changed to 2 hairs, and it will look transplanted hair in the future. So everybody will know this guy had a transplant. And the hairline, we should be having only 1 hair, which is micros. And so on and so forth. I always bring this slide to show that the good hair, which is you never lose in your life, most of people, it's about 12,500. But you cannot take all of this, otherwise nothing will stay when you become, say, age 60 or something. This is the only thing you can remove. The best hair possible is 8,300 plus for a good hair, which is 80 plus per square centimeter follicles. That's why we try to take the minimum possible to save the area. This cannot be taken, by the way, in one session. You can take up to 5,000, but you will look very bad. Actually, there is a shock effect. So we try to minimize the number. This is how I draw. This is not always, but this will give you more accuracy when I draw. This is just a laser beam. It has to be in men. It has to be like this. You have to have this clear. Most of the people we correct here, this has been transplanted already, and you have to take it out because it's very obvious that it's a transplant. There are rules for making the hairlines. Hairlines. What I do here, I measure from here, which is called the glabella, to the chin, and divide by 2, and then add 1. That's for men. For women, I just divide by 2 without adding any number. For men with a hair loss pattern like a woman, which is 20% female pattern loss in men, and they usually have the peak here in front, and they never lose the hairline. I should be careful and treat them like a woman hair loss, so I don't follow this rule. This is Artaz. It's a robotic machine. It acts from A to Z, taking the grafts without any nursing, nobody, just somebody monitoring the system. It says at the beginning that it takes about 800 grafts per hour, but now they retracted to about 400. I don't know what they're going to say this year in the coming meeting, but it's very extremely expensive. It's about $200,000 US dollars. So it makes things very expensive. So unless Chinese will duplicate, we don't know. Maybe it becomes 50,000 riyal, so the nurse will start just operating the machine. But the problem is you cannot take one patient at the same time, another patient, and the patient has to be in specific posture. It is a lot of work-intensive procedure. Now the nurses should produce about 700 to 1,000 grafts per hour minimum. That's our scope. Hopefully we can do that in a better way. Usually, I don't usually make this when I do it myself. Now I'm training my staff to know how to work with this. Now we are doing some new programs where we can make our residents start doing procedure with us for cheaper, for people who are looking for price and under our supervision as a consultant. But this, in transplant, we have to be careful about how many, this is centimeter square. We usually don't exceed 40 in the hairline, in this area. That's the peak. That's the main area where it really makes a difference to the whole transplant, the face, how the face looks for men, that's in general. And also in women. Women, a different pattern, but it's mostly this area that's most important. Women, we concentrate here, but we concentrate in the midline in women because that's what they wanted mostly. The peak is very important to make the thing look more natural, and we drop the hairline by illusion, not by fact. And that makes a difference. That's why we always, they say, why your hairline is high? But when I make this and it looks natural, it looks their hairline is low, but it's not low truly. That's how it's being packed after transplant. This is called dense. That's another procedure we used to do, and I don't do it as much because there are chances that you may lose some of the grafts here if you go to this number, 50 to 60. So smokers, I never exceed 40. If not smokers and healthy, I may go to this, they want super dense, and I will tell them there is a chance. There is a chance. Maybe up to 10% you may lose the area, no growth, completely no growth. And there are cases documented in literature. So the patient, when they come to this, I'll tell them, look, I'm really taking a risk. It may become the best transplant ever, and you may not have a good growth. So you have to tell the patient about this, because you are exceeding the limit. The natural is about 60 to 100, and the average is about 75 to 80. So you are almost reaching the natural in one session. So you are really pushing too much. The natural spread I always do is about 20 to 25 in this area. But when I go a little bit farther, I decrease. I may go up to 15 here also, here, 15, 10 here. But back again here, I will go to about 25. See, I cannot transplant everywhere. So this is called curtain effect. The hair will go direction-wise, going down. So when I do this, and the hair goes down, the hair, when it grows, it covers the area it's like a curtain. You have to be careful about how you place your grafts. Actually, some of the doctors, they call this a black hole. Whenever you put grafts, it will never look good. So if you make it good directions, it will look good. That's the case afterwards. That's called the superdense. But not all cases like this. When we repair may be needed, we have lots of repairs here. We have about 20% of our cases, up to 30 sometimes, depending on the season. But most of the average, about 20% of patients are repair, done outside, and they want to repair. And the old procedure where there's a strip, it's easier to repair. Now with the follicular units, it's very difficult to repair because mostly they come from Turkey and it's all obliterated the area. So we don't have any donor. Unless they have a chest hair, so we can correct. Maybe we take about 1,000 or less, but most of the patients, they come now for second opinion, doing FUE outside. They are over-harvested, we call them, and there is nothing in the back. Actually, you could see the skin. And we warn all about it, always. So most of what we see in general, even with the FUE, a correction of the hairline is always bluggy or not really a male pattern or a male face hair, or maybe there are gaps and big bluggy grafts, or maybe the donor scar is called stretch back, which is very wide, more than 1 centimeter. Or there is maybe a couple stoning. They put, especially people who are using punches, and still there are. So the hair will be standing on top. It's become like small mountains. And the fiber, which is not natural hair, which is a synthetic hair, we see less now. Okay? This is my team. I'm proud of this team in general, not only these people who are showing. However, not here. We have a great team here who are doing really good transplant and very fast and really ethical in their work. Now they do about 600 grafts per hour to replace. Hopefully they will go to 1,000 one day. These are the things we used to do. This is historical thing, by the way. This is we don't use anymore. This is an obsolete. And that's what I noticed in other areas where they do. They do the sites with this one. This create a lot of ischemia. So it injured a lot of capillaries. So if you think about it, when you do cut like this, if you think it's going to be a straight line, as if you're cutting with a scalpel. So you're cutting all the supply. That's why we have a bad, the outside people who are transplanting a good number of, like more than 3,000 grafts, if they use needles like this, I think needle like this, they will be, I think, good growth. No core, there's a no core, if anybody doesn't know no core. No core, now we use it for subcision and other things. It's like a gauge 18 needle, but has like a blade-like. Now we don't use it anymore because there is an injury too. So we are very careful now. We are using gauge 18 and sometimes 19, depends on the number of grafts. If it's fine hair for the micros and front line, hairline. And this gives the minimal injury. So you have good area to transplant. This is a patient done in outside. You could see the skin, obvious, but maybe the lighting here if making things difficult a little bit. And this is him after being transplanted outside. He said 4,000 grafts that they put for him. And that's the skin you see. You could see everything obvious now. That's him after transplant also, from outside. And that's him, that's the growth he got. And that's the danger of too much hair in a centimeter square. Okay, that's him. That's the back. That's more exposed. You see? You could see it's called mouth-eaten. If you remember syphilis, this is signs of syphilis, by the way, for dermatologists who have never seen syphilis case in the past. That used to be tertiary syphilis called mouth-eaten, or secondary syphilis. Secondary syphilis. Huh? It's secondary syphilis? Secondary syphilis. So it's become like a syphilis effect. Too much harvesting. Same again. See the hairline? It's like a woman. This has to be exposed. This one for men has to be open. Again. So, correction. That's another case. That's a guy we saw, that's his old picture when he went to that country outside, and that's before the transplant. That's when we corrected him. That's his couple stoning. I'm telling you, the punch. You see the white spots? There is not much hair left. They took all of everything. I hopefully show you the thing. This one was American, but I'm not gonna, because this needs an internet, who did the same thing on, and he's complaining. These are cases, this is very rare now to see, this case. Very rare. That used to be. This is just only, we just take this off. If it's inside the hairline, we just draw the hairline, and just a transplant in between, this will disappear. These are the cases that posted on the internet. I'm not taking from my photos. People who transplant outside, and that's what the results are afterwards. And this is another one, 3,000, you see, 3,210, and that's the results I got. And that's another guy. It's just massacre. Look at this. They took from here, which is not allowed, completely not allowed. See, this must be not touched. Even this area must be not touched. This one is no-no, complete no-no here. And it's been done. Look what happened to his head. No hair. So that's a problem. I'm shifting now to another thing, which is showing you the transected hair. This is being cut. We should differentiate between transected, and sometimes the nurses, they confuse also the nurses. This is transected, but this is not transected. This is a stage, this is anagen, this is telogen hair. This is 4 hairs. And that's an issue. The nurse has to be careful about this, because this is considered should not be put in a hairline or front, so it should be in an area where you want to dense. This is some corrections we do, and these are scars to be corrected. These are bunched with 1 millimeter. Now we use 0.8 millimeter. This is just to show you how to take the grafts, and this is the shaving afterwards, and that's at the same time with the tall hair, and the people with long hair, they could cover it. And this is just our squares. We really determine how many grafts you take per square. We take about 100 from each, around 100, 150, depends on the density. And that's before, and that's after one session. You see the back, the curtain effect? And that's the chest we take from the chest also. We don't take too much from the chest, however. We try to put it always in the vertex area. This is a 3 hair graft. The aim of hair restoration surgery is naturalness, socially acceptable density, good distribution, and minimal donor scarring. This is the essence of hair transplant. Hair transplant is not a high number. I'm not going to return your hair as back as you are 18, but you will be naturally, you can dress, your photo look good, great and everything, but not you become like one of the singer. I always say you will not be like Wael Kfouri when you come to me to do an HT. You will look natural, but not high density, and that's very important. So people with this medical tourism can make you lose a map, and that's a guy who sent it from Heil. He puts it on YouTube actually, and he drew everything, so they know where to go. Thank you very much. Questions? Comments? You mean pharmaceutical? Pharmaceutical?
Yes.
Oh yeah, I didn't mention this. With regards to the pharmaceutical, we have only things approved here, which is minoxidil and finasteride, and obviously deutestride. Deutestride is available in the market. It has a little bit of extra side effect. However, minoxidil is a must for men and women. It must be used for life to prevent progression of hair loss, because as you know, if you could stop it, by even if you have no time, just use it once a day at night. And women, I always advise, and that's very important for a dermatologist, you should tell the female not to spray directly on the scalp. And they should use 5%, by the way, if they are androgenetic. 2% doesn't work in women. People, this is a misinformation. 2% is not good for androgenetic alopecia in women. It must be 5%. I know there is a hair growth on the face, or hypertrichosis, or even hirsutism, but if they spray it on their fingers and they just spread it with their fingers, they will minimize the absorption. But you need 5%. Definitely you need 5% once a day for women. There's another thing also. For people with seborrheic dermatitis, you should clear the seborrheic dermatitis with Debrusalic for at least 2 weeks. And then you have to teach your patient how to use the anti-dandruff shampoo, which is 10 minutes every other day. They must be 10 minutes, minimum 5 minutes. Otherwise, shampoo will not work at all. With regards to women, there's another thing about women. 50% of our population, they have at least 50%. They have low serum ferritin. To determine the iron store is not the hemoglobin, and that's a misunderstanding. Hemoglobin is okay. Maybe you get people with 12 hemoglobin, but they have less than 20 serum ferritin. Serum ferritin must be above 50 minimum, and you have to correct with a real ferrous sulfate or ferrous gluconate. It has to be a good dose, 300 milligram. At least once a day for minimum of 4 months. And they take with the spray also. For propecia, which is finasteride, that's what I usually write. And there is misinformation also on the internet all over. Now patients are on the web and everywhere. And they are doctors, they are religious, and they are historians, they are politicians, and they know everything. And even the patient, when they come to you, they think they know better than you. And that's a danger. So you have to tell them what they know, and with good discussion, actually, with a polite way of teaching them. The side effect of finasteride is less than 2%, any sexual effect. And it's not true. Actually, even with the sexual effect being recorded, 900 cases were done, and only 2 patients complained. And then when they convinced them, everything reversed to normal. So I think it's a psychological effect, because it's a 5-alpha reductase number 2. It's not the one we are talking about with the sexual effect. However, deutestride, it goes to up to 44%. It's stronger, it's better, by the way, because it blocks the alpha reductase 1 and 2, and it's really better results. For women, I start giving now with transplant or bad cases really, but I warn them about pregnancy, and they have to sign like Roaccutane. But in non-married or post-menopausal, I will give them Destroid, why not? Or finasteride. Lots of things work. Some of the things which we mentioned, they may work, which is all pharmacies are full of things that may work. But they depend on the placebo effect, which up to 30% of placebo could affect sometimes. There are things which can work, maybe, but not really studied. So we cannot really recommend it unless it's FDA approved or being studied with a comparative study. We are scientists here. We are not salesmen. So that has to be differentiated. What's going on in the sales store, that's a different story. But when you ask me scientifically, I will tell you, I cannot tell you this is work or doesn't work. So that's very important with regards to science. But sometimes psychology, you have to treat psychology sometimes. And you get, especially female, somebody who they have nothing and they want something, you have to give them something. But you don't want to give them medicine with side effects.
For the natural thing, do you believe in it that I don't know what you call it, say the jajir, that increase the density of the hair?
Yeah, especially الجرجير. I think وش اسم الجرجير زي الحشيش. لا كمان الحشيش أحسن. Anyway, there are lots of things in herbal treatment. The problem with herbal medicine in general, that's my view. And everybody has his view, and that's my view as a physician. I think there are things in herbal works, but the problem with the herbal medicine, or herbal medicine if you want to say it, but in American slang you could say it herbal. The problem is not it works or it doesn't work. The problem what comes with it. Medicine is being studied and we know the side effects. And we know the quantities. We know what to expect. However, herbals, we don't know what's inside this capsule. Yes, it has an effective material, it works. But the problem, what happens to the kidney, what happens to the liver, what happens... We have people, and vitiligo, we had cases who they give the brake oil. The one they take it from the... they take it from the oil exchange areas and they just take it and they put it for the vitiligo. It's true, works. Because it burns with the sun, any burn with the sun create inflammation. It create, if you get sunburn, by the way, and if you have vitiligo, you may repigment because there are pigments inside the follicles. This is not the thing is, but the problem is that lots of people, they got renal failure. And this is a case published in 1984 in Al Jazeera newspaper, I remember that. In Al Shumaisi, lots of cases have got renal failure. The problem of medications, aflatoxins and other things, liver failure, lots of issues, especially the thing you take, you ingest. The most danger is the ingestion. Topical, we could, if it's limited area, you could accept it. But if it's large areas, you have to be careful with absorption. There are mercuries, and especially bleaching agents, which they claim it's herbal, it's not herbal. We caught cases, I remember in Toronto, there Chinese herbal shop, and they're giving people eczema treatment for kids. And we took the kid, the eczema completely went, and they cleared the patient. They brought the sample and we examined its dermovate, completely dermovate. They mixed dermovate with it. And here in Eastern Province, there was somebody giving herbal medicine for diabetes, and all it completely downhill inside. So you have to be careful for people cheating too. So I'm not saying herbal is cheating. No, there are things working, but the problem, it's not authenticated and not being studied. That's a problem. Anything being studied, I'm not opposing.
The baby to increase the density of the hair
Actually, you answered already. You shave the hair, doesn't make a difference. The only thing, because if you see the grass, when the grass grows in, you see it's peaked. It has like a peak. It's like a needle. But if you cut it, it becomes square. So what they're doing, actually, they're cutting the top. And that's the end. And the hair will grow. It becomes thicker because it's natural to grow thicker because it's growing. You are just seeing the thing going up. It has no effect in shaving on hair growth. Actually, just I don't want to interrupt. There are patients who are. That's what there are the sign. I can tell if the patient has a hair and they come to me. I can tell they've been shaving before, even they have full hair. Because frequent shaving can also, and that's adverse. It creates, especially people who are bald. They want to go with completely shaved. Nobody knows that they are bald. With time, with frequent shaving, they have really weakness and growth. And that's, I noticed this. Is it scientifically based? There is no scientific. No, no, we cannot mix science and this is, I know, but, and you cannot tell, but doesn't say it make a growth. That's the main thing for me. And like religious practice, that's another story. Thank you very much.